All right, folks, we are live again. Surprise, surprise. Today we're going to be talking about healthcare and murder in the USA. Oh my God. Pretty dramatic, huh? I bet it got you to click. Yay. Anyways, we are back. We're going to be having a general conversation. I'm going to give you guys, as soon as I find a window that's working, because there's something going on with the YouTube studio right now, but I'm going to give you guys a link to how you can join us. Let me just grab that. How does the USA stack up against other countries? I also can't wait to debunk all these people that think that Canada's healthcare system is somehow terrible. I can't wait to debunk all of you. It's going to be so fun. I can already see the stream of comments. You have to wait 10 years before you get your ankle fixed in Canada. Yeah, no, that's not what happens. Join the live discussion here. Booyah. We got a huge boost in the algorithm last time. I wonder what'll happen today. So yeah, we're focusing on the USA. Let's beat up on the USA, shall we, today? See if we can trigger someone. Just a little bit of reading to wet our chops like we always do. The United States healthcare system consistently ranks lower than those of other high-income countries across several key performance metrics. Despite having the highest healthcare expenditures globally, the U.S. underperforms in areas such as access to care, administrative efficiency, equity, and health outcomes. Access to care. The U.S. faces significant challenges in providing affordable and timely healthcare services. A 2024 report by the Commonwealth Fund highlights that Americans experience more financial barriers to care compared to residents of other high-income nations. For instance, 38% of U.S. adults reported skipping recommended medical treatment due to cost concerns. 38%, in case you missed that. A stark contrast to Norway, Norway's 8% and 9% in the Netherlands. Administrative efficiency. Administrative complexities contribute to inefficiencies within the U.S. healthcare system. The same Commonwealth Fund report indicates that a higher percentage of U.S. physicians encounter difficulties related to insurance approvals and payment processes than their counterparts in other countries. Equity. The U.S. exhibits pronounced disparities in healthcare access and quality, particularly among low-income populations and racial minorities. Lower-income Americans are more likely to forego necessary care due to costs, and racial disparities are evident in maternal mortality rates and preventative service utilization. Health outcomes. Health outcomes in the U.S. are suboptimal relative to other high-income countries. The nation has higher rates of infant mortality and lower life expectancy. For example, the U.S. has a preventable mortality rate of 177 deaths per 100,000 people, more than double Switzerland's rate of 83 per 100,000. Healthcare expenditures. Despite these challenges, the U.S. allocates a substantial portion of its GDP to healthcare. In 2022, health expenditures accounted for 16.6% of the U.S. GDP, significantly higher than the average 10% among other high-income countries. So in summary, while the U.S. invests heavily in healthcare, it continues to lag behind other high-income nations in delivering equitable, efficient, and high-quality care. Addressing these systemic issues is crucial for improving the nation's overall health outcomes. So some countries that score higher, according to CEO World Magazine Healthcare Index: Taiwan, South Korea, Australia, Canada, baby. Oh, yeah. Sweden, Ireland, Netherlands, Germany, Norway, Israel, and about 25 more other countries. Additional perspective, the Commonwealth Fund Mirror 2024 report evaluates healthcare system performance across high-income countries, focusing on access, administrative efficiency, equity, and health outcomes. Yeah, top performers were Norway, Netherlands, Australia, and Canada. Okay, cool. Well, a little bit there for the room to sink their teeth into. What is, like, we have a lot of Americans in the room. Feel free to use this opening bit to air your frustrations or to go to bat for the U.S. healthcare system if you think it's adequate or decent at all. Go ahead.
TRICARE is awesome. Everything else sucks.
So CJ says tech is awesome. Everything else sucks.
No, TRICARE.
Oh, TRICARE. What's TRICARE?
You get it if you're in the
military. It's military care. It's TRICARE. Basically, it's like health, dental, and I forget what the third one is. But TRICARE is what you get when you're like ex-military.
Okay,
you get
so
on the TRICARE plan. It's basically the equivalent of like Medicare.
So I'm gonna check, how does military healthcare in the USA compare to other countries' healthcare?
Because it does depend, I believe. I forget what the distinction is for the veterans that don't retire as like officers, maybe. Like there's I forget who can get access to TRICARE, because I think for most veterans they just get the VA. Isn't that right?
I'm sure there's a difference in coverage versus regular enlisted, how much you're in, and like if you retire as an NCO or something like that.
Yeah, because I know the VA, from what I've heard, has a horrible reputation compared to TRICARE. Like my parents have had TRICARE, and I had it through them when I was still like underage, and it was good. But yeah,
the problems with TRICARE just seems to be like. I mean, the biggest problems with TRICARE are like providers who are out of service, right? So you just have to travel farther typically for TRICARE. That's it.
Yeah, it's like
depending on where you live. Yeah.
From what I'm reading here, it's like the U.S. dedicates considerable resources to military healthcare, like TRICARE. Structural complexities and access disparities present challenges. In contrast, other countries with integrated healthcare systems for military tend to be more equitable and efficient. I'm going to look more. I'm going to look more into this.
I mean, like people love Medicare and Medicaid. They love TRICARE compared to for-profit insurance programs that we have in the United States.
Yep.
I mean, it's not even in the same ballpark.
Right.
Yeah, I think everyone should be guaranteed like some sort of measure of it, right? TRICARE isn't perfect by any means. If you look at the stitches I got from a corpsman versus the stitches I got at a actual hospital, they're night and day. But I paid $0 for one and a lot more for the other.
Can I ask you guys a question about TRICARE?
Yeah, man.
Of course.
Go ahead.
Like I'm just curious how this compares, because like I sort of remember when my grandparents were on Medicare or Medicaid, whichever it was, and so they at some point both of them required assisted living and stuff like that because my grandpa had a stroke, and so like. What I remember is that when they were looking at like assisted living homes and, just like how they could sort of modify stuff, for transportation, there was always, like realistically, we would go look at like 3 or 4 options, for whatever it was. And so it was somewhat limiting in that sense. I'm wondering if like TRICARE, whatever the military equivalent is, like do you the way you guys are talking about it, it sounds like you go to like a big gray building and you just some guy uses a chisel and hammer to kind of close you up or something.
What's your question?
TRICARE is more along the lines of It's just a government-provided healthcare system, right? So you'd still go to your same general practitioner, right? And the only thing you have to worry about is who is in and out of network. But that's something that people with insurance in the United States are dealing with all the time anyways. You're dealing with in and out of network physicians.
Yeah, and what I was talking about is the hospital I was next to was I think probably the one on Camp Lejeune. So if you go to the Marine Corps, like actual hospital, or I think the Navy runs all of those, but it's going to be run by a corpsman, which is someone in the military, and their standards for a good patch job are lower. You can use your TRICARE. Like, if you go to an on-base hospital, you're not going to be using TRICARE because it's already covered. But TRICARE is like, you use that off-base. You can use it.
Correct. Yeah, it goes to your local GP or whoever you're seeing.
Not all for whatever
GPs are in network, right?
Oh, so it follows you. Follows you is another way of saying it.
Yeah. So I'll put it this way. I have a brother-in-law who uses TRICARE, and the nearest place that he's in Colorado, the nearest place that he can go to for medical assistance, or not medical assistance, obviously you can go to hospital, but for a general practitioner is into Wyoming. So he has to drive an hour and a half to go to Wyoming. Outside of Colorado.
Why?
I know, because that's what the insurance provides.
That's what happens when you get public health care.
No, that's not public health care, because public health care would just
I'm joking.
Is there something about how do doctors go through the process of which getting approved through whatever insurance? How do you?
Oh no! The doctors actually get to choose what insurance. Say I'm a doctor and I open up a general practitioner. I get to choose what insurance I take, and the way you select what insurance you're going to take is going to be based off anything, right? You're going to look at this insurer's rate of return, how often do they turn down claims, right? Because then you're going to be supplying these services without having the money coming in from the insurance company. So you're going to be weighing your risks and benefits, right?
Yeah, I was listening to something the other day of a therapist talking about the United Healthcare situation, his perspective of often he wasn't paying attention. The way he described it was you're just doing your thing, and most of the time you're not worried about that. And especially on the private side, you're doing all this stuff on your own. It's not like you work for an agency. And he figured out over time that it was United that consistently was denying these claims. And he was he started calling them up, was trying to go through whatever process to see if they were just different from all the others. But that makes me wonder about the TRICARE too, because when I was on it, I had a similar thing of doctors just being I won't accept it. It's why?
So is the feeling then of at least this some aspect of U.S. healthcare and TRICARE, it's maybe you catch it, whatever, you get sick, you get a cold, whatever it is, and then at some point, It sounds like you guys are saying you can't just go out in the marketplace and if I break my foot, normally I think, well, I can go to the podiatrist because what a podiatrist does is fix feet. And so I've got someone to pay for that. But it sounds like it's a little more goofy or whatever, in that context.
No, you have to go to your general practitioner and then they'll prescribe you to go to the podiatrist.
Yeah, and you can go there. You just have to pay for it yourself if your insurance company is going to say, no, we're not going to cover it. And that's when all of a sudden you're going to be oh, that's a $1,500 cost for me to go and see a podiatrist. It's fuck me running, right? Why am I paying $200 a month for insurance? if I have to pay $1,500 out of pocket.
I mean, no, because first you have to go to the emergency room or to your GP, and then they're going to have you get an X-ray and an MRI so that they can check off those boxes, and then they're going to send you to an orthopedic surgeon who will send you to podiatry.
I just want to echo that because that's a big deal. Because I've had I've had like lung issues. I've had some issues with one of my ankles, and in some cases I have like no out of pocket. Like I have the $25 copay or maybe a $40 copay for a specialist, and I'm in the U.S., right? So I'm in Phoenix, and other times when the same thing happens, if I have to call, like for whatever reason, I have to call an ambulance or something. Or I get routed around like emergency or specialty care. There's other cases where I've had diagnostics and stuff like that not covered, and so I just wanted to mention that too.
Yeah, correct.
Yeah,
and if the ambulance that picks you up isn't in your network, they're going to charge you even more, even though it's their fault.
One thing that has to be said about like TRICARE specifically, because I brought it up, is it worked for me, but for all the time that I was under TRICARE, I was in an area that was very near a military base, right? So if you're near a military base, you're more likely to have the local providers actually accept TRICARE because a lot of their business will be from TRICARE, from people covered by TRICARE.
Correct.
Now, if you have 5 people in your local area that are covered by TRICARE, why would you even bother, accepting it?
Yeah, because the
somebody
cost.
needs to.
Well, the cost for the business to go through all the paperwork and everything that's involved is going to outstrip the cost of any benefit. It's like the cost benefit analysis doesn't make sense at that point.
You have to
pay Isaac, can I push back on that a little bit?
Insurance?
Isaac, I got to push back a little bit on that because from what I know, it ends up being actually a negotiation process where like payers can set rates and they might do it by geography or by care type or the demographics of patients or something like that. And so it sounds like from what I understand, and again, I'm not an expert on this type of thing, but there might be some form of like leverage or something. And so it's basically it's to me, I thought it was basically like a sort of like a business contract, and then you can choose like who you work with.
Correct, but the leverage comes from how many people you have in any specific policy, right? So if I'm an insurance provider and I'm in an area where I'm covering 10 people, the cost to me is going to outstrip my benefit, right? So if I'm in an area that I have 100,000 people, I'm going to make profit, right?
Now, hear me out. This is why we should remove profit incentive.
Yeah. I mean, I'm all for single payer. That's my personal opinion, but that's just my own thing. Single payer is the same thing. We're just putting the entire United States population into one insurance pool.
So are you guys, and I know this is, you guys just mentioned that sort of concept of profits. Are you confident that like starting that conversation could potentially lead to better or the same level of care that we currently deliver in terms of like the mechanisms in place and sort of the number and the skill level needed for the types of service networks?
I think necessarily yes. Because if we shift the goal of healthcare from profit to like actual health outcomes, and we start doing things based on health outcomes as opposed to profit outcomes, that would necessarily bring up the level of healthcare in the US, unless people are ignoring healthcare number one and doing something else.
It really is a matter of number, you guys, right? So imagine you're a health insurance company. You take on 10 people. You only insure 10 people. While they're young, you're just making money hand over fist. Once they get old, you're going to lose all that money. You're gonna have to pay out everything, right? That's the idea of like a one pool single payer system, right? So instead of having these different groups of people, some older, some younger, and you can adjust like how much you're charging based on how much usage of healthcare services are being used. You can adjust like how much you're charging people, right? So if now all of a sudden, if you expand that pool out to the entire population of the United States, it's going to be cheaper for everybody.
So what if I can ask you a question on that? What if maybe I put on for a second, I think, whatever. I'm like a business forward Republican political candidate, and I say, well, look, one of the problems is that if I wanted to start a new like digital health insurance agency or something, like as a matter of fact, I could focus a lot of my marketing on actuarial pools of people who are a little cheaper to serve. So I can focus on younger populations, maybe people who, grew up with a household income of at least, $70,000 or $80,000.
Correct.
And I'm looking at this and I'm seeing that, hey, I can actually impact 15 million people or something. Isn't so like, I guess I'm asking if like all profit motives are considered, like that's a grandiose question, but are all profit motives equal?
So I think the issue that you're going to run into is you're going to be chasing short-term gains or long-term. God, why am I forgetting the word? Like dependencies. I forget the exact fiduciary word, but long-term responsibilities that you have for these people that you're insuring, right? And that's what happens. Like these companies will do things and then all of a sudden they're bankrupt and be like, oh no, well, like I know you put all this money in, but we can't cover you anymore. Sorry, we're broke now. Right. But at the end of the day, the people who were running that company, they had the golden umbrella and they all got their millions and they fucked off to fucking have a great life, right?
Yeah, I mean, I like that. The logic makes sense. I didn't mean to cut you off there, but like the logic makes sense. It just seems, sort of a little narrow in terms of like looking at like, I don't know, like an old health system like we have in the US in Arizona. You have people a couple years out of, med school and residency, doing stuff, sometimes with just like pure clinicians, people that have been seeing patients for 30 years. Some people will be like, we have a Mayo Clinic, so you have people who still publish research and stuff and do clinical work.
Yep.
Like, and so like that kind of stuff, it seems like, I don't know, glossed over.
No, I mean, that's definitely important, but look at elderly care. Do you think elderly care is better in the United States or Canada or France or Germany or England? I know England's having a rough time right now and they're in some shit, but it's still better than what we have.
Bro, we are spending way too much money on old people.
Yeah, I don't know. I think that's such a hard question to answer because I'm not in that situation. I can just tell you my like attitude or feeling is that I'm not confident that we have the level of elder care that we should have or need in the US.
For fucking sure, dude. Yeah. Dude,
but I don't have experience, but I've heard stories, right?
Yeah. Dude,
I will tell you as a person.
I was going to say for my dad, we did in-home hospice, right?
I was in a situation a few years ago, working at a psych ward where the hospices in the area were so impacted that they started sending some of their dementia patients to us because we were less impacted than them.
Yeah, it's fucked up. And I am so glad that I was in a position, my family was in a position that we could do in-home hospice for my dad. But
yeah, dude, I don't mean to cut you off, but like that's such a great, like, like, sorry to hear that, but also like that's where, like, I don't know, I can be super optimistic about healthcare, but like there's no bullshit. Sorry for the swearing, but there's no bullshitting someone who's like using end of life care or something like that.
Yeah. Oh no. I guess what's your point? Bullshitting somebody using end of life care.
Yeah, I mean, I think if someone is honestly exploring how healthcare sucks or can be better, like aren't the sort of like, people, whatever, their experience, their reported experience, or if they think, it was like a fair or, there's dignity or whatever in that experience. I don't know what I was saying with that.
Oh, yeah. No, I mean, I guess I'm just talking about my personal experience with the healthcare system, what it would have cost. My dad did out or like inpatient care, and it was like 50 grand a month, something like that.
What?
And it's like, yeah. That's fucking, it's
my
crazy
God.
fucking expensive, dude. It's fucking insanity, dude.
Are you fucking serious?
My child being born was $60,000.
What?
Yeah, I mean, yeah.
Yeah.
Okay, I got to tell you guys, I'm about to have my first child. Now, yeah, you can research the Canadian tax rates that like a middle class person or an upper class person would pay in Canada, and you can compare it to your country and come back to me and tell me if you think those tax rates would make a huge difference in your life. But my wife and I have had a midwife appointed to us from day one of our pregnancy. Monthly meetings with the midwife. We and then it becomes bi-weekly as we start getting closer to the due date.
Yeah.
Which, by the way, baby's going to be born any second now, so I'm super pumped. But that's
Congrats!
That's the thing.
Yay!
That's the side quest here compared to this very important live stream. But all of these things, we're going to be going to the hospital. Anything can happen. You might need a C-section. You might need all this stuff. Whatever ends up happening, however many days you need to stay, you get sent home. The midwife comes on 4 occasions at 4 different stages after the child's birth.
After the birth?
None of this costs me anything. Zero. Zero.
I mean this from my full chest.
You pay
with
taxes.
all of my heart. Fuck you.
Zero.
You pay taxes, Travis.
But Travis, you get taxed and then it's no, I'm sorry.
Zero. I will place a financial bet right now. I will put $10,000 down. So if anybody wants to tell me that the amount of taxes that come out of Canadians' paychecks for healthcare comes anywhere close to the amount of pre-taxed income that is taken from my paycheck every single month from
Listen,
healthcare.
I'm just going off of what Bernie says, but I'm pretty sure the dude says we pay like at least twice as much as other countries.
What about
I pay $150 a month pre-tax for healthcare.
How
that rationed out?
Sorry,
it's a lot.
Sorry. How could
no? You're good. You're good.
How could you have a system where you charge your citizens for bringing new taxpayers into the system?
Yep. I'm going to make this even sadder. When my daughter was born, because she is a new human being and a new citizen of the United States, she was not born with healthcare. So it turns out that she doesn't just like come out being able to like sign off on these things.
Yeah.
And she came out as she had jaundice, as many children are born with jaundice. And so we had to take her to the doctor every day to get blood work. And I saw the bills for it because they had to send them to us. And then we were like, okay, well, we finally got her enrolled. So like take the bills back now. But it would have been several $1,000s for us to not have a baby with jaundice.
Wow.
Yeah.
After we had paid $60,000.
I'm so sorry. That makes me sick. Greg S.
Yeah.
Greg S. just said in BC my MSP payment every month was $75. So MSP up until a certain point in time, there was, I don't remember $75, but there was a small monthly payment for your medical service plan, which is the universal healthcare plan in BC. Alberta was free. It was kind of different by province, but as of 2020, you pay nothing for MSP. And I'm going to pull up right now how much was the monthly payment for MSP before?
Dude, Travis, I put about fucking $100 every month into an HSA, and that is not even including my contributions to my insurance plan, right? So I have a health savings account, and that's used if when something happens, I have a savings account that's going to go towards my deductible. My deductible is $10,000 per year. My maximum out of pocket. Yeah, dude, I know, dude.
No wonder, fuck.
This is what I was saying the other night.
Fucking shocking.
I know when I was talking about the difference between Canada and the U.S., it's drastic.
Before 2020 in BC, you would pay if you made 42,000 or less per year, you qualified for in most cases full premium assistance, so you would get it covered. If you're making over that, for a single individual, you'd pay $75 a month.
Dude, that's
my God.
Nothing. Yeah.
And that was in BC, but other provinces, this was free, right? But now, totally eradicated.
Yeah. Yeah, I pay $75 a paycheck, and some months that's 3 paychecks in 1 month because I'm paid bi-weekly. So some months that's fucking $225 that I'm paying out.
Man,
that doesn't cover my deductible when I go and see the doctor. Like I'm gonna have to pay like a certain amount out of pocket every time I go and see a doctor, usually about $50 to $100. Then you have a yearly out of pocket that's $10,000.
But here's a crazy thing. Let me say this again. Despite having the highest healthcare expenditures globally, the U.S. underperforms in areas such as access to care, administrative efficiency, equity, and health outcomes. So the problem is whenever you hear a politician in the U.S. saying, we need to invest more in healthcare, kick them in the balls. Get right in the balls.
Well, we allow hospitalists and the insurance companies to go back and forth on how much each product within the hospital costs. And they kind of like one up each other so that both sides get profit. And because we let them do these internal negotiations without any oversight by anyone else, they can end up being like, yes, Vaseline, you mean that thing that costs $150? And it just turns into that.
Dude, they'll charge $20 for a pill of aspirin, right?
Yeah.
So this is the reason why people in the United States, after this fucking execution, were like, who fucking cares, right? It's like it's. I don't think it's a lack of morals. I think it's just like people being like sick and tired of being fucking sick and iron, right?
Yeah, but that's like misdirection of one's moral
sense
at the level of jihadism. Like, you know,
no, I don't think it's jihadism. Like, if you're gonna say like, oh, who fucking cares about that, as opposed to being like, no, what we need to do is start killing CEOs. Like, if you're doing that, like, yeah, like that's obviously incorrect. But to me, like,
we're gonna get into
I don't have any like moral qualms with that dude getting killed. Like, it just doesn't bother me, right?
Yeah,
and it's
it would bother you if it was your uncle who was the CEO, right?
It totally would.
So your empathy to me, like, you know, a moral person can look at a situation and put themselves into that, right? Like, you're gonna, you know, that's how empathy works. You're gonna look at that, and I think, despite the ideology, despite the politics behind what you're seeing, there should be some care boiling up within you. And I think that the moment that ideas, because we're talking about ideas right now, the moment that ideas start stifling that empathetic drive, in the face of cold-blooded murder, I think that's when we have a radicalization issue, and maybe, Scott, you have been, or maybe you are extreme and radicalized by the state of the healthcare system.
No, like, here, I'll put it this way: the idea I would disagree with. The action, I just do not feel any like crazy like empathetic response to what has happened, right?
It's kind of like how
and
a lot of people are
like that says a lot about the state of our system right now, where people are like so sideways with their finances and taking care of themselves that they don't feel like they can empathize with something like this. They don't have the emotional bandwidth to even see it as a bad action.
And I also experienced some like really horrendous shit when my dad was like fucking going through end of life cancer treatment and shit. And it's like, are you fucking kidding me? Just stop. Like, why? Just fucking, just give us the fucking green light for this fucking treatment.
Yeah, but I think I understand that, and that's like
problem.
You're obviously, it's all valid for you to feel that way about what you had to go through in your personal experience, but I think it is wrong of anyone to graft that onto this CEO as though, you know, he wears the burden of the system. I think that's a disgusting idea. Yeah.
I was fighting against that idea earlier in morality today, in the morality channel. It's like, no, just because that happens, that doesn't mean you can kill people. Like, that just fucking nonsensical.
Yeah. Yeah. I would just say one thing too, is that, like, you know, I think when people, like, my own POV is when we're grappling with the moral and the practical questions of something like this, even if it's something that shouldn't be that difficult, you know, like, it's easy to take like a giant block that's hard to understand, if that makes sense. So, like, to me, like, you know, I can think when I sprained my ankle, like, it caused me some emotional trauma. It took my foot a long time to heal. And I was also working at restaurants. This was like a decade ago or something. And so, you know, like, I think to me, the right way of doing something like this is being able to like say, like, hey, look, you know, like, I don't know that this healthcare CEO or even a congressional hearing is going to tell me, like, look, Nate, you need to see a therapist, and you also need to go do your physical therapy and see a podiatrist about whatever it is that you're actually working on right now. And so, like, but that, like, I know there's not a lot of like Kamala people in here, but like that holistic view, I think, is like something that's really important to me.
Well, yeah, I mean, I think there are probably more Kamala people in here than you might think, but
that would make me pleasantly surprised, but not to.
Well, I mean,
dude, I'm a Kamala person. In case he's a Kamala person.
I also would have.
No, you're not.
Would have voted.
That's crazy, dude.
Kamala person.
I also would have voted for, you know, Kamala as well, and nobody has been able to tell me, demonstrate how Kamala is the more evil of the choices so far. It's that part's been quite humorous to listen to people be like, yeah, it's just like, I didn't know anything about her, man. Well, it's like, yeah, if you only listen to Joe Rogan, then you won't know anything about her.
Well, Travis, she didn't. She was part of the Senate during the ACA, if I recall, but she was not. She did not campaign on a healthcare platform, other than I think maybe was it Medicare or Medicaid prices or funding mechanisms or something.
She had a healthcare platform. Yeah.
She did.
Yeah. So we went through all of this in our live shows. She was big as Biden was on reducing medication costs and her, obviously there's a healthcare component in the United States, like seeing how much healthcare costs for people and families. Their economic policies, obviously, I think should be considered as part of the healthcare policy, in that they were fighting for higher taxes for the 400K plus earners and lower taxes for people under that and the middle class. So, I
didn't know all that. Sorry,
but
I didn't mean to say something ignorant.
It's all good. But we don't have, that's a huge topic, but yeah, we're going to be doing some topics eventually here once now that the Democrats have burned everything down and there's nothing left but rubble and people wondering what the hell happened. They have to build a new circus and show. It'll be interesting to see who they build that show around, but there'll be lots of.
That's a good point. Yeah. I think historically, at least I think Democrats got somewhat accustomed to having the healthcare conversation top of mind, even if it wasn't the main issue people were voting on.
Yeah. I wanted to read something here. The recorded net profits, and I want to read this because I'm from Canada and it's crazy, right? So
it's going to blow your mind.
The pharmaceutical industry net profits for 2024 are looking to have expanded by 35%, reaching 170 billion in profits for 2024. Medical technology, medtech, anticipated growth of 38%, achieving 72 billion in profits. Healthcare information technology, IT, projected to double, reaching 28 billion in profits. Now, what good is a country? See, this is the crazy thing. People in the United States, I hear them all the time, more specifically conservatives, talk about how, up in Canada, you get robbed by your government through taxes. As far as I can tell, a government that allows this is robbery. This is what robbery looks like.
It's straight up getting butt fucked.
And a lot of people are going to argue, and a lot of people are going to be like, "Oh no, it's it's just citizens, engaging in capitalism and capitalizing on people."
No, it's not. It's not even robbery. They make the prescription drugs that people need to not die so unaffordable that they die.
Hey, I don't know how true it is, but I heard that some healthcare company was trying to minimize, covering anesthesia for the whole operation.
That was Pfizer. And then after the CEO was killed,
these people are getting milk for their money. It's insane.
Yeah, that was Aetna. That was Aetna Health Insurance that said that they were going to put a limit on the amount of time that general anesthesia could be applied to any patient, right? So if that actually like went through, imagine you're in general anesthesia in some sort of surgery, and the insurance company is like, oh no, like you
and
it's
they can
an
only cover
hour now,
2.
boom, yeah.
So
and you have to pay. It's like super expensive. You have to pay the next 4 hours. It's like, all right, good luck, right?
okay,
Yeah, or they would have to go super fast during the surgery.
but you guys, like, luckily, the well-informed American public would notice this, and they would be looking to vote in someone who's going to save the day and stop the robbery.
Why can't we?
I got something to read here.
Travis, why can't we stay civil during that conversation?
Hang on.
Hold on.
I'll go on mute.
Okay. Let Travis
There's
finish.
nothing uncivil about what I'm doing. This is just called rhetoric. Calm down. So they're going to vote. They're going to vote someone in, hopefully, that stops this robbery. Let's see what Donald Trump plans to do to address this. And then we can also bring in Trump to the conversation.
You mean his concept of a plan?
President-elect Donald Trump's healthcare agenda for 2024 indicates a significant shift in U.S. health policies, focusing on deregulation, restructuring federal programs, and altering existing healthcare laws. Key components of his proposed policies include Affordable Care Act modifications. Trump has expressed intentions to modify or replace the ACA, commonly known as Obamacare. While specific details remain unspecified, potential changes could involve reducing federal support and introducing alternative solutions, potentially affecting millions of Americans' healthcare coverage. So nothing in there. Just like maybe something will happen.
The problem, right? Like, it's only 4 years of like a 4-year term, and whatever the previous guy did, like the next guy in the next 4 years is just gonna do something else, and they're not gonna follow. They're abusing this kind of stuff. Like, these companies, they know. They don't give a damn. Nothing is going to change in 4 years.
It's not even Donald Trump that's going to be in charge of the policies. He's already handed that off to RFK Jr. So it's going to be his ideas and his brainworm that are going to tell us what we are allowed to do for healthcare.
Right. The anti-vaxxer and the guy that thinks vaccines cause autism.
Yeah,
right.
Pro ivermectin, man. Yeah, going to do a line of ivermectin before we all get extra brainworms for all of us.
But wait, there's more. Medicaid restructuring. The administration plans to target Medicaid for significant budget cuts to offset costs from extending the 2017 tax cuts. Proposed reforms may include implementing work requirements and spending caps, which could heavily impact low-income populations relying on Medicaid for healthcare services. Prescription drug pricing. Addressing prescription drugs is a priority, with discussions around tax and regulatory reforms aimed at making medications more affordable. So that's a good one. I like that. Mm-hmm. Policy changes may involve encouraging other developed countries to pay more for drugs, allowing U.S. prices to decrease, and modifying laws to permit healthcare to negotiate prices for expensive prescription drugs. And actually, that's a similar policy than what compared to what Kamala Harris was running on as well. There's also Medicare reforms. The administration is considering significant changes to Medicare, including making Medicare Advantage the default option for enrollees and altering payment methods. They're considering this. So leadership appointments influencing healthcare. Trump's cabinet selections signal a potential shift in health policy direction. Robert F. Kennedy Jr., wow, a noted vaccine skeptic appointed to lead the Department of Health and Human Services, indicating a possible reevaluation of vaccine policies and public health strategies. Get ready, folks. Dr. Oz.
Yep,
really?
Dr. Oz. Welcome to the fucking clown show.
Dr. Oz nominated to lead the Centers for Medicare and Medicaid Services, suggesting future policy shifts affecting the current ACA structure. That's a nice way to put it. Reproductive and LGBTQ healthcare policies. The administration may implement federal restrictions on abortion and gender-affirming care, potentially reversing
abortion, really federal,
and impacting access to these services. Okay, I just wanted to give an update of what's gonna, the White Knight and what he's gonna do.
And I just want to say personally, I haven't heard anything about what like exchanges are. This is also because I've put in zero effort, but like what are exchanges measuring in the healthcare system right now, and how they're planning to adapt, as needed going forward.
One of the things that they want to do is decrease the power of HIPAA. So where my notes can't be accessed unless I'm subpoenaed, if it was shown that I was using the code or let's say gender dysphoria, then my notes would then be able to just be opened to any government facility that would want to read my notes. So if you're doing gender affirming care, if you're doing abortion, you wouldn't be protected under HIPAA anymore. There would be no confidentiality. That's part of their plan.
Well, any kind of interference anyone's trying to run on abortion so that females can have, which should be a human right, access to have a safe abortion if they want one. That's a disgusting, immoral policy. I just have to say.
I agree.
Yeah. I think abortion as well as privacy are, I think again having, whatever my own personal context where I care about the future of healthcare. I think both of those are important issues.
Yeah.
Having a really hard time. Like, how is it the U.S. can't do anything about this? I mean, they're on it, isn't it? Like it's part of the whole thing, It's just
there's plenty of money there to do it.
Yeah,
the matter is
Congress,
the people.
Sorry,
it's how the money is distributed, right?
Yeah,
and that's what you're dealing with is like people who are trying really hard to control the redistribution of wealth to themselves.
I think, what I would like to see in Canada? I would love to see Canada have a policy, just free and open immigration. And Canada will even help move your family up into Canada from the U.S.
You wait. You mean
if I could move to Canada right now, I fucking would.
Take me. Obviously, there's other, but I'm talking about the abortion issue here. If some woman has evidence that she's been denied an abortion, that should give you direct access to move and settle in Canada, in my opinion.
Yeah.
We are trying to.
Are you advocating? Are you advocating for a woman to be able to have an abortion just because she wants one?
Yes.
Oh my God.
Yes, I am.
So
up until based on the law in Canada, up until I believe it's the 27 week mark or 20. No, I think it's 25 week mark. I can look that up.
Dude.
But yeah. For any reason that the female wants to have an abortion up to that date, I should shut my mouth. It's her decision. I don't understand why the long dick of males in our society feels like it can wave it right, smash women in the face with it when they're trying to make a difficult fucking decision. Let them make their fucking decision. It's their fucking decision.
I have a controversial position. I'll say let's allow abortion up to 72 months.
Whoa! I can't believe it.
No, but
let's allow abortion. That's a 6-year-old child for you guys trying to do the math.
No, but seriously,
man.
But seriously, I think there also should be laws, and this might bother some women to hear this, but it just. In Canada, there's no doctor out there that's going to give you an abortion after the legal date that you're no longer allowed to have one. It's just not going to happen. So I think that should be codified into law that you can't have it, so that women are clear that they will not be able to get it after this date. That education should be driven home into everyone so they understand the ramifications that this is the important date. and whatever happens, just let me get this out, Scott. Whatever happens out after that date, whether your husband or the person that you were making this baby with, let's say they die in a horrific car accident, after the 24-week mark or whatever, you have to realize that you're not going to be able to get an abortion after that for any reason. That should be clear. That should be, people should get the fair education on that. But I think that should be codified into law. And if
what about life of the mother?
What's that?
What about life of the mother? What is about life of the mother? You said for no reason.
Well,
yeah, I mean, most abortions that occur in later terms of pregnancy are not elective abortions. They are
Isaac, can you go on mute just so Robin can finish? Sorry.
They are health-related abortions, where the life of the mother is in danger, or there is a fetal anomaly that will cause suffering in the baby, and the baby will not survive after birth.
Yes, Robin,
I
have a different word for that, because the entire abortion conversation is almost always about the elective abortions that happen. I think we should call what you are describing right now a subation or something like that. Because
but see, in the United States, right? Though, in the United States, though, that is where we're having our big problems. Is this right here? Because the states like Kentucky, where I live, they push these bans, to where their wording is so confusing that it is not allowing doctors to know whether they can even give these abortions or it's a delivery after viability anyway. But they're afraid they're going to go to jail if they bring on this, if they terminate this woman's pregnancy when her life is in danger. I mean, and in some states, it's not even her health. Like, she can lose organs. And in Texas, there are women, two women have laid there and died because they let them get up on the brink of death before they even tried to save them.
Okay, Robin, I want to ask you, I want to check with Robin for a second here. Robin, where did you say you're from where this is happening?
I'm in Kentucky, but Texas we had a woman die in Georgia, and we had a woman die in Texas in like the last, and they both died because they were allowed to lay with sepsis and come with almost to the death's door before the doctors felt like they had the legal right to go in and save women.
And also, to tack on to that, like, Robin's point isn't just a microcosm in Kentucky. There's actually quite a bit of data from Texas as well. I forgot which other states passed the early legislation bans.
Well, I think
that was one of the things that helped Arizona pass a direct ballot measure.
Most of these states are not providing a lot of information about the maternal death rates. That's actually a problem. Texas is one of these.
Yeah, but like Travis was saying, we were trying to address if a woman just wants one, right? Like Travis is pregnant right now. He's about to have birth, and if for whatever reason his wife had a mental illness or something and was like, I want one now, Travis, that would be crazy.
Past the stage of viability. So if it's past the stage of viability, past the stage of viability, doctors can talk with the patients, and at that point, what you can do is just induce the regular birthing process. If the baby is healthy and the woman seems like she's going to be okay.
Yeah.
Right?
Yeah,
So
if we do
Roe v. Wade should be allowed up to viability anyway. I mean, that's where the cutoff was for Roe v. Wade.
I want to respond to Wise's question here because he asked it earlier. So, yes, I think up until the 24 or 25 week mark in Canada, if my wife would have said, for whatever reason, mental health reasons, whatever, that she needs to have an abortion, that's her choice. That's her choice. Completely. after that date, by law, she's got to go through with it. She has to. That's the law. So it would be before that date that decision needs to be made. After that date, the only reason why it's going to be terminated is for doctors feel like they need to, because there's a risk to the health of the carrier.
There's no other option,
right? Okay.
Yeah,
and I wanted to give more air to what Robin was saying here. So yes, doctors in Kentucky have expressed significant concerns about their ability to provide necessary care to pregnant women, especially when a late-term abortion is required to save the patient's life or health. I still think there needs to be a different word for these, the late-term ending of the pregnancy, because a lot of people hear abortion and they think it's the carrying mother deciding. That's what the cultural conversations of it. So it gets confusing. But the state's stringent abortion laws, which include a near total ban with very limited exceptions, have created a culture of fear among healthcare providers. This environment forces physicians to choose between adhering to their professional ethics and facing potential legal repercussions. So what a terrible issue, and what a horrible problem that needs to be fixed, in my opinion.
Yeah, Travis, you said it perfectly. Like, it's like the elective state of it, right? So an elective abortion is different than an abortion that's derived from a life-saving process for the mother, right? So in that, yeah, we don't have another word for it, so we just, I guess, have to use the words. We have to use a combination of words versus elective abortion.
Like an elective procedure can still be something that obviously is for the health of the patient. Somebody gets a nose job and it's considered elective, but it actually helps them to breathe better.
Well, we do actually have another word, though.
We could just say medically necessary.
After viability is called a delivery, not an abortion.
What if
just a reminder, excuse me, sorry, just a quick reminder that the reason Roe vs. Wade was settled in the first place as well was it became a privacy issue, and it's the ruling stated that a woman's right to choose is actually control of her her body, and and viability. Basically, the ruling was that viability doesn't it's only at a certain point that goes into that. So. Like I just wanted that sort of that set of neurons to light up.
What if a woman?
I just want to add a word. I want to add a word here that might help us. There's a difference between elective and mere elective. Mere elective is just because I fucking feel like it. Elective is not the same thing. So mere elective versus elective are two different things. We are talking about before 24 weeks. It's mere elective. Whatever reason, rhyme, the woman has a right to choose. Past that, you can still have elective abortions. It's not mere elective. There's a reason, right?
But even what you just
said.
What
if there's a woman that starts going to church and they convince her that her atheist husband?
Wise, 2 seconds. I just want to respond to Don Don. Even what you just said there, Don Don, my argument here is to the average listener who listens to the abortion issue. When you just said after that date, people automatically think that it's still a decision that the caring mother can make after the 24 weeks.
Well, in Canada, I don't think they can. In Canada, you need a doctor as well to agree and sign off on it. You no longer have the ability to just decide yourself. You lose that ability after a certain time.
As someone who's in Canada, you need someone else to sign off on it. You need a medical person to sign off on it.
What area would not? Because I could understand for the early stage, if you just need a pill, you can have that mailed to you. You don't really need a doctor there. But for the later stage, you need somebody
stages,
there to be performing it.
It's for the later stages. You can get a plan B in Canada anytime.
Yeah, and
if you're getting a surgical abortion, someone is by virtue of someone else also electing for it, right? I think that's Casey's.
Well, and it's a personal decision, I think, is also it isn't just intuition. If I say, hey, this is a personal life-saving decision, isn't that something that's relevant?
I want to read this for the record just so we have it. So in Canada, access to abortion after 24 weeks is limited and is typically only performed under special circumstances. These circumstances are the life or health of the pregnant individual is at serious risk, or there are severe fetal abnormalities that are incompatible with life. So those are the two that you can, but this would be in concert with the doctors and the surgeons.
And it's still subject to like you can still. So I think one of the things that people have said is as an externality, like, you know, maybe this is me being egotistical or not knowing enough, but I think if you ask for an abortion in Texas, you can still have, like, in theory, there's a path to a prosecutor where you can be prosecuted for, you know, for that. Isn't that true?
No,
by
that's,
definition.
That's even the point that I was going to go to. In Texas, what they did is they passed a law that said a normal citizen can sue another citizen if they think that they're getting, or if they think that that person even benefited somebody getting an abortion. So, like, if somebody comes to me and says, "Oh no, in this situation, it might seem like a good idea that you should have an abortion," you can now be sued by another citizen in Texas, let alone being, like, criminally liable for.
That's bonkers.
You can get life imprisonment.
It's insanity.
Yeah,
it's insanity.
Absolute insanity.
So medical professionals who perform abortion. This is in Texas. Perform abortions outside the legal exceptions, which are possesses a life-threatening risk to the patient, or could cause substantial impairment to the caring mother's bodily functions. Are the potential penalty is life imprisonment, fines up to $100,000, and the complete revocation of medical licenses.
Plus, they tried to propose a bill, which hasn't passed yet, but they keep on pushing it, to where a woman who does an abortion actually gets the death penalty.
What?
Is that a Kentucky law, Robin?
No,
we know you laugh so much.
Sorry, Robin. Is that a Kentucky law?
They have not made it a law. It's in Texas. They have pushed it. They have proposed it several times in front of their legislation. They have tried to get it through. It has not passed, but the Republicans want it through. They want the death. They are so pro-life that they are willing to give women death penalties for abortion.
And on that note, I'm putting some gin in my sweet tea right now.
Pro-life. They're so pro-life, but they don't care about the healthcare situation. Like, what a stupid contradiction, right?
Right. We're so pro-life, we will kill you.
It's not Texas that has that law. There's a few other states that are trying to implement the same policy.
Unless you're sick. I mean, if you're sick, I mean, we don't really care.
Well, and so, you know, it just seems like it's also not to explicitly state it, it seems like it's making a gender-specific medical issue about gender, or like it's almost like dehumanizing or something to some extent.
Yes. So, some U.S. state legislators have proposed bills that could classify abortion as homicide, potentially subjecting individuals who undergo the procedure to severe penalties, including the death penalty in some states.
Yeah, South Carolina, Alabama, and Texas.
Well, some states are pushing this notion that you can say a mother does something, doesn't wear a seatbelt, or takes some sort of action that can be considered negative towards her unbirthed child or whatnot, negative towards the fetus, then that is legally liable as well. So think about this. Like, think about the long-term implications of this. It's like, okay, so a woman drinks a Mountain Dew, and now we decide that Mountain Dew is not healthy. Now she's liable for any sort of bad outcomes that her child has. It's craziness. Like, legally speaking, trying to make heads or tails of it doesn't make any sense.
They do that with Big Pharma all the time, though, with certain medicines, and then you see it late at night with the certain medicines being sued because of XYZ ingredients, or XYZ individuals were having certain side effects.
Yep.
Yeah, and even in pharma, I think I think this is true in all medicine. Like you can indicate risks and stuff like this, and they still look at the entire process. And if there was, small things out of line, then I think like the distinction between culpable or not culpable, those sort of like I don't know, they don't play games, I guess.
I'm chuckling away here because ever since Scott said Mountain Dew, it reminded me of that old conspiracy theory of how Mountain Dew causes erectile dysfunction, and I wonder if like some other company spread that, because that was I remember that being a huge conspiracy theory, and I typed it into ChatGPT to see what it would puke out.
It's hypertension.
Yeah,
is it true?
Yeah, you can make an argument as to how it, like, the high sugar content can lead to this, can lead to that, can lead to that, can lead to obesity, and that can cause erectile dysfunction.
No, it's the green. The green makes your balls shrink.
And then secretly, Coca-Cola investors were shorting the stocks of Pepsi.
As a chemist, I can agree that green food coloring does make your balls shrink. Green is stored in the balls.
CJ, how does that? You're gonna have to explain that off air, brother.
So the Hulk definitely shouldn't be green. He should be a different color.
Now, was that chemistry or alchemy?
It's actually kind of both.
Mark, we got to get Marcus in here.
It's Marcus. Dude, it's all about the techne. Come on now.
Yeah.
We all know this.
Yeah, man, you got to be able to make your own medicines. You got to upgrade your techne. Who else wants to speak ill of the American healthcare system, or does anyone have something positive to say? Or how many people are moving up to Canada now?
There are actually many positive things about the American healthcare system, though. I mean, we are responsible for the biggest advances in medical science, right?
Yeah.
I don't know if that's directly related to the way we pay for healthcare, but in the United States, we are the fucking best at innovating healthcare.
I think a massive amount more than it per capita
for research.
Hey, one at a time. Let's get Canaman. Let's get Canaman first, and then we'll go Prometheus. Go ahead, Canaman.
Cool.
I just want to say, if privatization, which is what the idea behind the current healthcare system is the answer, then maybe we should privatize the research and publicly fund the practice of healthcare. It seems like it would be a lot more even system that way. And then back on the subject of abortion, I just want to say nobody's out there trying to regulate what men can do with their body.
All right. Thanks, Canaman. Let's go to Prometheus, and then we'll get some responses and open it up.
Just point out that America spends, as I recall, is it 2 or 3 times more per capita on medical bills than Canada does? It's roughly equivalent to the UK.
It's way more than that.
Okay.
Yeah.
And that could explain our R&D success.
So one of the things that is notable about the American healthcare system, of course, with someone said their medical technology and their research, but I think something that's overlooked is the way in which our academia intersects with the healthcare market. Our professionals, our doctors are very specialized, very well trained, and very well educated in medicine. And this cooperation between that industry and the academy is something that nations around the world either try to emulate or come here to learn. So,
agreed.
Yeah, I mean, I'm looking this up right now. Like, if there's any kind of study about the competency of doctoral training, that would be interesting to see. I'm interested to know what other countries do well. So yeah,
that's interesting, because I would my just like my right or left brain, whichever, is thinking like shouldn't like at like in high school or something, people tell us how Like if I do 2 residencies or something, like how effective that is versus doing 2.5 or 3, or splitting those up or doing more together or whatever.
So countries with high competency doctors, United States, of course, like Don was outlining, known for cutting edge medical research and advanced treatments. But obviously there's the problem of the top tier care is only accessible by top tier people economically.
Correct.
Then Germany is up there, the United Kingdom, Australia, New Zealand, Canada again is up there. But we have universal healthcare system. God, it's great to be great. Donald Trump should take some lessons from Justin Trudeau. What do you guys think?
Of course, DJ's been raised in
So should he go in blackface?
Really? When we're talking policy, you're going to go to blackface when we're talking about Donald Trump? The guy
please don't call it up.
The
He's
guy
like a
is
dumb
a criminal.
college kid.
He is sexually assaulted women. I don't think the blackface is a problem here.
Yeah, we got to go full we got to go full orange face. We got to go full orange face. Come on now.
Yeah.
Look, I wouldn't put
college
sexual
kid. There's some statute of like limitations on doing dumb shit. No.
What?
Trudeau did that decades ago when he was a kid. Shouldn't there be some sort of statute of
No, I know, but this is what happens.
Okay,
with I'm not saying
it's not equivalent to grabbing women by the hoo-haws.
I'm not saying CJ is a hater of Trudeau or a conservative or whatever. But I am. But this is what happens though. Like a guy like Trudeau who just like can't stop winning in his country, right? He's a winner. He's not boastful about it in the way that like people who lose, like how Donald Trump lost, not this one, but the last one. Like, and then he doesn't, he's not out there spreading conspiracy theories. Like, so, and then they target him for like shit. Yeah, he did when, some ignorant shit putting blackface on, I think you're really picking at or what's the term?
Grasping at straws. Grasping at straws. Yeah.
I'm not a conservative, but and I would say Trudeau is probably better than Trump. Okay, I'll say
probably.
I'm just saying he's not the miracle baby.
As a Canadian who lives in Ontario, Trump is way better than Trudeau.
Oh my God! Travis, okay, I want to hear that argument.
We gotta have a Canadian off. One second. I gotta look into the Canadian off. We got PC versus PlayStation Canadian off. I'm ready for it.
We just got an Alex. Answers that are wrong for 1,000, please.
Dan, are there any Israeli laws on healthcare?
Wait, before we go there, I want to let Gluteus air his issues with Trudeau. If he has some.
Where do I start?
Yep.
Oh, Lord. To be honest with you right now, it's way too late to be getting into it for myself. Okay. I kind of came here as a fly on the wall.
Yeah, no worries.
But at the end of the day, I will say a quote that my mother said to me, which I laughed at very much so, but at the same time, when you think about it, she's very much right. I'd rather have a businessman run my country, even if he's an asshole, than a clown. Because at the end of the day, you can take the businessman serious. You can't take the clown serious.
I'm not on the side of Trump. Hold up. No. I'm not on the side of Trump here. But at the same time, Trump was an actor for much of his career.
The dude was on fucking Celebrity Apprentice
and if Donald Trump's not a clown, like, come on.
He's definitely a clown, but at least he's a business clown.
I don't hate.
Well, Donald Trump sold real estate, but he also did a lot of media, and so I think that's somewhat related as well.
He's P.T. Barnum on Orange.
Yeah, what the fuck?
Yeah,
there is like a housing crisis in Canada, though, so he's not perfect.
No.
Yeah, as someone who was going through a hard time, and even when I was going through a good time, could barely afford living and stuff like that.
Where were you living?
It's just going to get worse. I live in London, Ontario.
You live in London, Ontario, and you come over to Vancouver and try living here.
Are you kidding me? I want to come to Vancouver so bad,
dude. The real estate is unless it depends. Like if you're wanting to live the single life, Vancouver is the place to be. But if you want to raise a family and
I have a daughter, I can't live the single life. At least not in the way that I would love to, if you know what I mean.
Yeah,
at least like traveling.
Yeah, depending on what your career. I mean, there is lots of opportunity in Vancouver, but I don't think you get what you pay for in Vancouver anymore. It used to be, I think, a better balance, but yeah, it's just very rich real estate market here.
One of my friends online that I talk to all the time, she lives there, and the only reason she stays is that the sights. She's like, I only stay because it's beautiful. It's like I work my ass off for sights.
Yep.
Yeah, my old VP paid. I used to work in Vancouver, and the VP there paid $2,600. I think it was a nice apartment, but it was like 1 bedroom. You could see the water, but it wasn't like prime waterfront property or like whatever. But
yeah,
like even right now, like where I am, it's $1,500 for a 1 bedroom, and it's still considered like this part of the city is still considered not the greatest part of the city.
Oh, it's getting to $2,500 for a 1 bedroom within the city limits, like a 1 bedroom anything in Vancouver. Yeah,
I'm definitely not going to Vancouver then.
Yeah. Yeah.
Or wait, let me rephrase that. Vancouver.
Unless you get lucky and you get locked into something old, or you can live like, they are improving the SkyTrain station. So if you don't mind taking like a train into the city, if you have to go into the city, then, they are working on it and you just move out a little further. But yeah, it's, it is a beautiful city. It's still probably my favorite city, but I want to buy, 10 acres of land, I don't, and buying 10 acres of land, like 10-acre plots don't even exist within Vancouver. You have to go out to like Abbotsford and it smells like cow shit out there. So I'm not really big on that.
You know what? I ran a farm for about 2 years and as a live-on farmhand.
Do you miss?
You get used to it.
I mean this. Yeah, no, I mean this honestly. Do you miss the smell of cow shit?
I miss the smell of money. Yeah, I do.
Yeah, the cow shit smell of money. Yeah. That's fair enough.
100%.
Yeah, fair enough.
That's why it's called golden yellow. That golden yellow in the fields, that's money.
Oh, we used to shovel it when I was young because my parents.
I was a live-on farmhand, so I mucked the stalls and everything like that. Sorry, I interrupted you.
No, that's fine. We would shovel it to make manure for my parents' gardens because they would have so many big, large gardens growing up. So.
Hell yeah, we had about 15 pigs. So every Halloween we would go around the neighborhood the day after Halloween and with a flatbed and collect everybody's pumpkins.
Yeah. Since we're on the topic,
and that's what we fed for the pigs.
When I was about 13, my dad came home and his present to my mom, because he was just visiting with my grandpa or something, and they went to a horse auction, and the present my dad brought home to my mom was a pet cow. And
hell yeah,
we named that pet cow Arby. And for those of you who aren't familiar with Arby's, Arby's is a fast food restaurant chain where they serve like sliced beef sandwiches. So we named him Arby, and
that's fucking hilarious.
He was trained more like a dog than anything else. And we would like ride him with our hockey gear on. He would, if you whistled for him, he would run up to you and stop like a dog would.
Oh yeah, they get the zoomies too. The cows get the zoomies.
He would get out of his little pen all the time, and we would like miss our school bus because we'd had to try to retrieve him, and he was so big. And then one day we came home, and my Uncle Carl was visiting, and he's a butcher. And we came home and we're just walking. We actually did quite a hike home from the school.
Oh, bus. Travis, don't finish this story. This isn't going to be funny, dude.
And we got to the top of our hill. We looked down,
it's going to be delicious. You're right.
We grew up in a hunting family. So this wasn't like, it's not like we didn't see this coming, but we just saw, this carcass hanging up, and we didn't see Arby anymore. And we were like, oh, they're butchering Arby today. So.
Oh no.
Yeah. But
makes you feel.
I grew up for those who don't know, I grew up on the outskirts of a village of only 1,500 people in a hunting culture. So, yeah.
I thought you were going to say a hunting village, Travis. Well, I didn't know.
it's like a mix between like conservative hunters and left-wing liberal hippies. It's like a split right down the middle of the community.
But that was still the 90s, so didn't you guys have internet and cable TV and stuff like that there?
We didn't have internet yet there. No,
wow, didn't. So not even in Canada they have cow healthcare. Wow. All right.
Yeah. Selling horse meat though out here illegally is pretty fucking bad.
I'm about to go to bed, so I quickly just want to answer Nate's question about healthcare in Israel real quick. It's on my mind. So basically, everyone has to pay, like you're mandatory to pay through like your depending on your taxes into like Kupat Cholim, which is just like the healthcare, and basically there's like 4 major healthcare providers.
Sorry, I don't just step back. So are there any laws or anything around it, or is it
you have to pay? You have to. You comes out of your taxes, and you get to choose like a healthcare provider. There's like 4 companies, and you can switch between them if you don't like them.
So your only choice is where your taxes, where that money goes to, but you don't get a choice. It comes off your taxes anyway.
Yeah, there's universal healthcare. So
okay.
Yeah, that makes sense for Israel. That they will do that, Okay.
Yeah.
Didn't prior to the war as well, didn't like some number of Israeli doctors work in the West Bank and stuff like that as well?
I don't know if any Israeli doctors work in like the area A and B.
Definitely it was like after a residency or something like.
Definitely in area C. I mean, some people might. I mean, they might even. Yeah, some. I don't know exactly what's going on.
So I'm just getting back into like politics and stuff like that. When you say area A and B, what do you mean?
So the West Bank is divided into Area A, B, and C. Area A is under the PA's control. Area B is under the PA's control as well, but there are checkpoints from the IDF, and then Area C is the area that is controlled entirely by Israel.
Okay. Thank you.
Oh, so Israel only controls one of them?
Yeah. Fully. And the PA also fully controls only one of them, and then Area B is like a mixture.
It's like a mixture, like a halfway point.
How long has that been?
Since the Oslo Accords.
Who has the better healthcare, though?
Probably Israel. I don't know what they do with healthcare over there. I have no idea.
Probably the one with hospitals that are still standing.
Huh?
You don't live in Israel yourself, do you?
No, I grew up in Israel.
Okay. That's fantastic, actually. That's really... So my father... Well, sorry, I grew up in foster care, and my foster dad, I just call him my dad. But we housed and drove international students from all over the world. So we've had people from all over the world, from Sri Lanka, from like all different parts and stuff like that. And I think one of the most interesting conversations I've ever had is people from Sri Lanka, or like different parts of like that side of the world. Yeah, it's a different world, man.
Yeah, it's been stated in a lot of places, like a lot of the developing world. Usually when there's like a new government or something, like having an autonomous and effective healthcare system is usually like one of the first things that like the government should facilitate through both public and private means. Like it's a fairly like apolitical institution from the Western and pretty much any perspective. So there's always like challenges, but there's not usually a lot of pushback as well for like healthcare.
Well, what we're going to do is we're going to take all this down into the off-air channels. We have a politics channel down there for anyone that wants to keep talking politics. I'm going to be sitting in the tavern because I got a bunch of videos to make. Just some interesting stuff that's going on right now. I'm planning a lot of new live on-stage discussions for 2025 right now. Been talking to Anna Kasparian, a lot with Destiny, Stephen Woodford from Rationality Rules, a lot with Alex O'Connor. A lot of different people are going to be making their Pangburn on-stage debuts this season. So get ready for that. Yeah, I'm making a deal right now for Anna and Destiny to sit on stage together.
Oh, so my God.
That'll be a fantastic head-to-head discussion. But I wanted to give you guys, I was talking to Anna's agent all day today, so we're probably going to be able to make this work. So look forward to that. There's a lot being planned. Enjoy the daily clips. I love seeing your guys' comments, and we've been breaking records on our daily clips for the first 24 hours of engagement with them. So this has been fantastic. I just want to say thank you to everyone. I see we have like 500 people, 589 people listening right now to our live streams. Guys, please consider getting involved with these live discussions. I want to hear your voices. I want to hear from you. Join us on Discord. We have a beautiful, thriving community on Discord, and I love that we have some new members here today that chimed in. We have conversations going on all the time. If you work late, if you work early, you're always going to be able to find people, from different time zones from all around the world who are interested in talking about things. And don't be afraid to be the conversation starter in the off-air voice channels. Sometimes no one's in there, and when I pop in there, then all of a sudden 10 people are in there. So pop in there. Usually people will join you to have a conversation. But we are going to shut down the conversation tonight. Thank you, everyone. Make sure you drop a like on the YouTube live stream on your way out, and again, make sure you join us on Discord. But this was a great short.
Thanks, Travis.
Discussion. Yeah, thanks, Nate. Thanks, everyone, and we'll talk to you guys later.
Thank you very much. Yeah, no.
Thanks. Skibbity.
Skibbity bap.
Merry